right? So let's begin the evening by welcoming our speaker for the opening address. Allow me to please welcome Mr. Sanjiv Navangul, the Managing Director and CEO from Bharat, Serums and Vaccines.
Thank you so much for the kind introduction and good evening to everyone. It is important to celebrate these kinds of events because ultimately Maharashtra has been the leader on every count in this country, whether it is education, whether it is freedom struggle, whether it is industrial revolution, whether it is thought leadership. In every case, you find Maharashtra ahead. So I feel very happy to be here on stage along with you. Look, I'm Sanjiv Navangul. I'm from Bharat Serums and Vaccines. It's a leading biotech company, and we do work in healthcare. And I'll take you very briefly through what the company does and how the last year during COVID, the company has contributed significantly to Indian healthcare landscape. And then I will ensure that I talk to you about how I feel the future looks like for healthcare. So let me share a few slides and talk through them, but then I will devote my time to ensuring to talk to you about healthcare in general. So, we also have a beautiful logo since last 1 year, which you can see here. But our important is our tagline, bringing life to life, because we are very seriously working on fertility as a business, as a means to ensure that mothers and couples who want to have children are not left to their own whims, but ensure that we help them through that. So this is a company, this is a brilliant year for us because it completes 50 years. This is a golden jubilee year for us. We are very, very strongly into emergency medicine, critical care medicine, and women's health. Women's health is probably our biggest focus. But in the last 1 year or so, critical care has become very important because in COVID, some of our treatments that we had were key to patients recovering. We are also a company which is highly specialized into R&D of biotech. So you can see on the screen that we have a very strong R&D team, but beyond that, we are the first in the world on some things. We are the first in the world on monoclonal anti-D. So anti-D is the Rh negative women who have to give birth to their second child and need to be safe. They have to be given an anti-Rh immunoglobulins, and therefore they can save their child's life. So this is very, very critical kind of medicine that we have developed for pregnant women, and therefore we are the first in the world. It's not like we are first in India or something. Monoclonal tetanus, we were the first in the world. Amphotericin B emulsion formulation, we were first in the world. We have many firsts in the country, but amphotericin came into quite a bit of discussion right now because of mucormycosis that hit the country. And we are the largest manufacturer of amphotericin B in this country. And therefore, when mucormycosis hit us as a country, we literally quadrupled our production and ensured that country and the state received the necessary medicines in time. Obviously, it is extremely important for us to be motivated by the fact that we take women's health and critical care very seriously as our path-breaking work that we do. Uh, there is several things that we do. In fact, in as I mentioned, in assisted reproductive technology, we do a lot of work on microfinancing, patient counseling, offering other services to ensure that the couples are counseled in a way that they feel confident about their decisions that they make. So this is an important part of what we do, because many a times they don't know where to go and whom to speak. And if you see, we now have a very nice website, BSV with you, which actually starts to talk about science and patient related assistance in a very big way. My personal belief is, I think as we go forward, we have this four things that run along all the time with us, which is drugs, device, disease, and drugs, disease, diagnostic, and device. But what is important is now we see that it is extremely contextual to ensure that digital is part of it. And therefore, this BSV with you is a very important initiative we have established. And clearly, the kind of things we are doing, including we are researching on equine-based antibodies to treat COVID patients. And if it is successful, then maybe in a very short duration, in a couple of injections, we might be able to neutralize the virus. So a lot of work has to happen for science to work to ensure that we build a company and build healthcare in India in a proper way. Our vision of the company is completely integrated with the fact that Indian healthcare systems have to improve. We are not bereft of it, and we are not separate from it. And that is extremely important for us. Uh, Obviously, as they always say, that a sustainable world means working together. And for us, create prosperity means create better health for citizens of this country. So now let me talk to you about how the future of healthcare looks. All of us have been patients, and patients are not some third party. It is you, me, our parents, our relatives, our loved ones, everybody, our friends, all of us at some point of time or the other become patients. And therefore, when we go through that phase when we are patients, imagine the kind of things that happen to us. Currently, a lot of disparate things happen. Like, you have to get an appointment. You have to reach a hospital or a clinic. That's a separate part. You have to ensure that you get your consultation done with the doctor. That's another. Then you have to do your pre-checks. You have to do diagnostics. You have to get a prescription. You have to get to the chemist to fulfill your prescription. You have to come back home and do home care, or somebody has to assist you at home to take care of yourself. Several disparate things happen with you. And all of us are at wit's end at times to how do we ensure that it works well for us. If that happens to us, imagine what happens to bigger part of the population of this country. And therefore, it's time we start technology to seamlessly integrate a lot of things. Maybe thanks to the pandemic, we are learning integrated ways of how these can be done. Today, last week, couple of weeks ago, I was feeling a little unwell. And then I said, I want to do my diagnostic test. I didn't go anywhere. I was at home. I called a diagnostic company. They came, they took my samples. I called a doctor. I did a video counseling with him. And I looked at a website where you can buy medicines online and fulfill your prescription. Everything was done sitting at home. I was very, very less worried about how things went. This is the future. This is what is going to happen in future, that you as a patient deserve your all the services that you need at the click of a button, and seamlessly in such a way that you don't have to struggle for it. And this is the way future should envelop for us. The reason this is very important for a country like us is that at different levels, people have to spend time or money or effort, which is disproportionate to what they should. Imagine, I have known of a simple person like a rickshawala. My daughter used to try and do some social work and teach in a municipal school. And she used to tell me these stories about rickshawala having to not be able to spend the day and take his wife to the hospital because he loses a day's income. So these are struggles. In tertiary care, minimum travel as you go down the area, just 50 kilometers from metros, is a fact that you have to travel minimum 1 hour or 45 minutes to an hour to get to a tertiary care center. So these are travels that we have, which should reduce for us. We should be able to get many things online. I think the way COVID was handled, even in Maharashtra, where you could just call a helpline and know that which hospital nearest to you has a bed, is the way we should be for future. The other part that is important is capacity and capability building besides technology. That we have doctors and our doctor to patient ratio is skewed, and it will take us certainly some years before this ratio gets improved. But to fill the gap in between, in most cases, you don't need doctors to attend you in primary care. Paramedics will do. Or if you need to be reminded of taking your medicines in time, if you are a chronic TB patient, or if you are a pregnant woman, to take your iron medication, ASHA workers, those kinds of capacity building on paramedics is very important. Capability improvement there and capacity there will mean there is less pressure on secondary and tertiary care in this country, and that is the way to go, and that is where it will go in future. The other one is, public sector and private sector. This is a big debate in this country. Should health be public or should health be a private sector initiative? To me, this country will need both. But what we don't want is that they should not be conflicting and doing the same things at the same time. They should be complementary in nature. If private sector is ready to build tertiary care and government of India through different schemes is ready to pay for that tertiary care, then leave it there. Let government take over primary care and secondary care centers. Build bigger infrastructure around it. So make it more complementary in nature. And the important part to support is, as I mentioned, is healthcare financing. That we need governments to ensure that healthcare spends have to improve. And I'll give you a very simple statistic to understand where our healthcare spending should be. We are the only top 50 economy where healthcare spending is less than defense spending. Normally, in every economy in the top 50 economies, the healthcare spending is 5 times the defense spending minimum. In India, it is the reverse. We spend 6 times on defense compared to health. I'm not saying that we should not spend on defense. That's not my point. My point is we spend very little on health. And therefore, healthcare financing is important. What has happened, fortunately, is because of the pandemic, government has also understood the responsibility of public health. And you see the budgetary allocation of 35,000 crores on just on vaccines. And this is something that we need to continue year after year. Maybe we may not require it for COVID vaccines, but we might require it for some other public health issues. But healthcare financing is extremely important, and that will supplement what is required. And healthcare spend, therefore, has to go up to 2.5% to 3% or 4% of GDP. This is important. Now I feel more hope that this could happen. The other one that I feel very important is disease management. Most of our diseases are managed in an acute way when they are chronic diseases, and they have big impact on health of this country. Diabetes and hypertension impact 1% of GDP every year now. So imagine if we not treat them episodically, but treat them well and manage the disease well, we will be in a much better position to productively use our time for healthcare. The one more point that is important to me is the fact that we give very little importance to wellness in this country. See, the important thing is not to fall sick, and therefore take precautions not to fall sick. I'll give you a very classic example. Mask usage improved in the last 1 year in this country, and it has reduced viral infections in this country substantially. It has reduced certain other kind of diseases that could transmit through breath. So some of these basic things, if you do from a wellness point of view, it helps. But imagine the flip side of this, that people staying at home, working from home has led to a lot of mental health issues. UK has just released a study that 24% increase in liver damage due to alcohol consumption because people are at home and not able to get out of their homes. So pandemics also have the negative impact on mental health. And therefore, how do we ensure that these things are taken care of from a wellness perspective? And how do we promote wellness in this country? I think the cleanliness drive in this country was an important drive that started. We should sustain it. along with this wellness drive is going to be important. All that I'm trying to say is the next normal is very different than today's situation. We have to reimagine health in these fashion. Fortunately, I I am in circles where there is a lot of policy think tank happening, and I feel much more confident today than yesterday that we are going in the right direction. Look at just Maharashtra. The CMO, the Chief Minister's Office in Maharashtra, was so progressive during pandemic that it was the first government to appoint an expert committee of real medical professionals to help through advice on the pandemic. This is not disaster management. This is pandemic management. And experts will need to be consulted. And Maharashtra showed the way. I'm sure many other states would have learned from it and tried to do the same thing. So this is where the new normal of health is going. I am feeling quite optimistic about where we are going. And we ourselves as healthcare professionals and as a company are completely dedicated and integrated to ensure that citizens' health is paramount to us. I want to once again thank the organization. I want to thank for bestowing honor on us. We are basically servants of healthcare for the betterment of citizens' health, and that is what we will continue to do. Thank you so much for sparing time to listen to me. I'm sure that you would have heard everything that I've said before, but I wanted to insist on saying some of these things. So thank you on my behalf, on Bharat Serums and Vaccines behalf, and the 2,000 employees that serve this health of the country in their own way. Thank you so much.